It's different for every couple and every type of couple, but I would say for most couples, if they are healthy, normal weight, and you have been trying for more than 12 months and have no other medical concerns, then that's a time when likely they are struggling with infertility if they're not pregnant by 12 months. Patients are considering making an appointment with a fertility doctor depending on their different circumstances. For most patients who've been trying to get pregnant for 12 months and haven't been successful, I recommend that these patients see a fertility specialist. Now, if you're older than 35, consider seeing a specialist after 6 months of trying. And for women who are in their 40s, I recommend seeing a specialist right away. Fertility testing includes a couple of different things. The most important thing is determining the egg reserve. Women are born with all the eggs that they have, and so it's important to know where they're at. The other component is the male factor. We want to know how much sperm is available. And then the last thing is just making sure that the uterus is healthy for a pregnancy and that the tubes are open to make sure that the sperm and egg can meet. There are different fertility treatments depending on the medical problems. There are some surgeries that are indicated depending on the medical problems, such as uterine anomalies, sometimes polyps, sometimes fibroids that require surgery. The other treatments that we have available include intrauterine insemination, or IUI. Other women just need help with getting regular ovulation, and those come in the form of medications. Prior to starting IVF, patients need to have completed testing to make sure that they are a good candidate for IVF. Following that, we want to make sure that we have a good protocol to give them the best chance of having a successful egg retrieval, and then we proceed with IVF. The different components of IVF include not only the different medications, but how we fertilize the egg and how we transfer the embryo. So those are all important components that we usually talk to our patients about in detail. That's individualized to the patient. The timeline for IVF can vary. There's different components. Specifically, there's the egg stimulation, there's the egg retrieval, there's the embryo development, and there's the embryo transfer. All this can happen relatively quickly within 1 month, or may take much longer depending on the patient's schedule and treatment plan.